Hi, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Thursday, October 1, which means we are 3/4 of the way through the year 2020. And I was joking with somebody this morning that we often say, hindsight is 2020. And I think this year we'll all be happy to have 2020 in our hindsight. So feeling good about that, feeling good about the way things are broadly going from a COVID perspective. Certainly concerned looking ahead to the fall and winter, really hoping we can continue to hold on to the progress we've been making and over the last month and really build on it this coming month. So things are looking up in Chicago. Let's go ahead and we'll turn to the dashboard in just a second. As a reminder, you can put questions for me directly into the chat below. We are also following along on either Facebook or Twitter with the hashtag AskDrArwady. You can go to chicago.gov/coronavirus for all information about COVID in the city of Chicago, or directly to our dashboard, which is where we're going now, at chi.gov/COVID-. So let's pull that up. Okay. And if we take a look at the landing page here, first you'll see on the top our test positivity rate is at 4.3%, continuing to drop, which is very good. As a reminder, test positivity is all the positive tests divided by all the tests that are done. And it is the number that the state use to compare across regions and to impose additional restrictions if necessary. It's also the one that we've said must be below 5% for us to be in a space that we feel comfortable relaxing restrictions. And so the fact that we've been under 5% now in a third week is a sign of good progress. Also, I was looking at the numbers yesterday, and there are 11 regions in the state of Illinois, public health regions. Chicago is its own region, and only Chicago and Region 6, which is the one that includes Champaign-Urbana, are actually under that 5% mark right now. So feeling like we're doing well on testing, always continuing to grow that and push it where, push testing where it's most needed. But that is some real progress. Similarly, if we look at our testing average, just below this, you can see our cumulative, we're coming up on 1.1 million tests in the city of Chicago, and our 7-day rolling average for tests is at 8,609, actually the highest it has ever been. It's been continuing to increase, and that's very good news. And partly in the context of seeing that increased testing, you can see it's up 8% since last week. Our cases are holding steady. We're at 304. Last week we were at 303, really right in line, and we like to see that increase in testing not being accompanied by a significant increase in cases. So things are looking pretty good there. If we move over to the daily demographics, this is where you can see our people tested. So this is where we deduplicate. Everybody is only counted once. That's also had a nice increase. Deaths are at 3. We've been going back and forth between 2 and 3 on average. And our person positivity is at 7.6%. As a reminder, again, that's the one test per person rule. So if somebody is getting tested multiple times, say they work in a long-term care facility and they're getting repeated testing, they only count once. And if you do it that way, it really gives you a better picture of how many individuals have been tested and how many individuals have been positive, as opposed to what does the testing volume look like. It's not that one is right or wrong, but they're used for different things. And that person positivity is what we use always when we're going to compare across ages or race ethnicity groups or across neighborhoods, because that way you're actually counting individuals, which is of course the most important thing where we want to understand the impact of COVID. And I think let's also actually look a little bit at the weekly data. On this middle button here is where you can look and see always for the most recent week. So this is for the week ending 9/26. All epidemiology weeks, they always end on a Saturday. It's how we do it all over the country. And you can see that we were at about 2,200 cases, a 2% increase over the prior week, but that people tested were up actually 14% over the prior week. Deaths at 22, up a little from the prior week, still remaining at a very low level. We've not seen an increase in emergency departments or hospitalizations. This tends to fluctuate a fair bit. And then importantly, the person positivity down a whole percentage point from last week. That's good progress. Where we look at the map on the right here, this, you can, over on the left, this is where you can change if you want to see cumulative, meaning over the whole time of COVID or just in the most recent week. And you can do either counts or rates. So let me kind of talk you through this. So if we start with, let's say, counts from the most recent week for cases, you can see that in the most recent week, the number of the zip code that had the most cases diagnosed was 60629, which continues to be, in a lot of ways, the main focus of where we're driving a lot of efforts. But if you switch from counts to rates, as a reminder, that's when you correct for population. So certainly a zip code that only has 3,000 people in it would be expected to have a much lower number of cases than a zip code that has more than 100,000 people in it. So rates are a slightly better way to kind of compare across areas. Again, you can see really this southwest area remains our primary area of focus, seeing some nice improvement actually in the northwest and in the southeast. But this is what that's looking like overall. And if we look cumulatively, keep it by rates, this, is showing that northwest, that southwest over, over the whole outbreak where we have seen the most cases. If we take percent positivity, this again is just defaulting to the most recent week, and you can see our highest percent positivity, mostly in the southwest here. This is very low down at the bottom here, but it's a relatively low number of people. This is a zip that overlaps between Chicago and suburban Cook, so we sometimes see this. So although it's the highest, if you actually look at the numbers by hovering, only 79 people were tested and 16 of them were positive. So it's a high percent positivity, but a relatively low number of cases. Nevertheless, we continue to really focus activities in the areas where we're seeing the most cases. I wanted to highlight some of the data around people testing, because I was looking at this yesterday and I was really pleased by this map right here. So when you look at this map, it's basically all the same color. And what this map is showing is cumulative rates, meaning corrected for population and since the beginning, and it's people tested. So this is the true how many individuals have been tested in the city of Chicago. You count once, even if you get tested 5 times. And this is where most maps where we look to see how are we doing on a particular health outcome? Usually we see, to be honest, often community areas on the south side and the west side really lagging behind. And that, as we've talked about, has a whole list of reasons behind it, everything from healthcare access to all of the root causes that have really led to differing health and access issues. But CDPH, as we've talked about, has stood up community-based testing to fill in and make sure that some of the parts of the city that sometimes have less access don't have that from a COVID testing perspective. And so what this is basically showing, that with the exception of a couple of really tiny zip codes here by the loop, which if we hover over them, this dark blue one, this zip code 60606 only has 3,100 people in it. But it does, if you look at people tested, 1 in 2 people have been tested there. So there's a couple little tiny zip codes that are 1 in 2 people being tested. Otherwise, across the whole city, it's 1 in 4 or 1 in 5. And I'm really pleased about that. It means that we've managed to make sure that testing is getting where it needs to get. We've actually done, if you look at counts then cumulatively, the most testing has been done on the southwest side, on the northwest side, on the southeast side, in the areas where it's most been needed. And if you, look at the most recent week, you'll see there's more, on the south side. Anyway, you can explore, but I just wanted to highlight some of what we've been saying. We use this data every single week to make decisions about where to push testing, where to push outreach, how to focus. So I encourage you to continue exploring the dashboard. You can look at age, you can look at sex, you can look at race, ethnicity, lots of ways to really understand patterns of COVID in Chicago. Okay, so I think with that, let's go ahead and turn right to questions. All right, Pamela Hall on Facebook is saying, does that factor retesters? And I presume you mean the statistics we were just talking about. So let me state again that the test positivity, that 4.3%, counts all tests that are done. So if one person has 5 tests, all 5 of those tests show up in that number. That is the way the state defines positivity and uses it to compare across jurisdictions. That is the one that, for example, out in northwest Illinois, the region that borders Illinois and Indiana that has Rockford in it, you may have seen that yesterday the governor announced that that region had more than 8% positivity. That's that test positivity for more than 3 days, and therefore is having the stricter restrictions put in place, closing all the bars, closing all the indoor restaurants, limiting further gatherings to 25, et cetera. So that is retesters in that it includes all of them. But all of the other data that I was just showing you on the daily dashboard, anything that has to do with geography or race, counts everybody one time. That is the better way for comparing across zip codes, comparing across age groups, because it means that you don't sort of get extra credit if you've got people in your neighborhood, for example, testing 25 times. That person may have a high risk exposure and need that testing, but it doesn't mean that that neighborhood has had, has had 25 people tested in the same way. So I hope that's clear. It's one of the more confusing things, and people use different ways of calculating percent positivity. We report both because we are sort of judged on both, and we use them for decision making in different ways. All right. Somer Core from Facebook is wondering, what is the cycle threshold for your tests? So this is a very lab-specific question. I'm guessing you have a lab background. The CT, the cycle threshold, is a measure for sort of at what point do you consider a test positive or negative? And somebody who has a sort of a higher cycle threshold, it lets you know sort of how strong is their how strong is the signal for their test to be considered positive. So the tests that we report out on are all tests that are positive, regardless of the laboratory that they're reported from. So there is not, the city of Chicago does not designate a cycle threshold to determine a test to be positive. It's based on the results that that particular lab and test have gotten through the FDA approval. So it's not that there's one cycle threshold for all of the tests. Jose Caballero on Facebook is asking, why is the Department of Public Health not checking businesses if they are enforcing their employees to wear a mask and customers? Okay, so there is a lot of enforcement work going on. It's actually predominantly through the Department of Business Affairs and Consumer Protection, or BACP, who are our sister agency here in the city and are in charge of all of the licensing and inspection of businesses. Chicago Department of Public Health actually does a lot of the food and the restaurant inspections because of food safety concerns, and we are also looking at COVID in those contexts. But for most other businesses, it's the Business Affairs and Consumer Protection. And there are many, many teams of people out every day looking at this. So if you are aware of a business that does not seem to be enforcing the requirements around mask wearing for either employees or for patrons, please let us know. You do that through 311. You can pick up the phone, literally dial 311, and it will bring you to an operator, but you can also go online, Chicago311.com, and you can fill out information about your concern, and then particularly if we're getting multiple concerns about a particular business, that can trigger an inspection. So we are doing actually quite a lot of work in that enforcement space. Most businesses are doing a very good job of this, and we really thank the people who are taking this seriously and trying to make their environments as safe as they can, particularly as we move into fall and winter, and we know that there can be more risk to indoor than outdoor environments. I want to be able to be in a place from an outbreak perspective that we can carefully have these businesses open, and making sure that we're abiding by the public health guidance, especially mask wearing and social distancing, are especially important. Okay, Lisa Dorner on Facebook. What do you think about the accuracy and sensitivity of the rapid COVID testing? All right, so there are a few different kinds of rapid COVID testing. And people who have been following along here with us for months know that testing is a complicated space that has just continued to evolve quickly, which is a good thing. Broadly, let's maybe just do a quick review about the three major categories of COVID testing, okay? There is PCR testing, also known as molecular testing. The most traditional, most sensitive testing that we've been reporting on all along. That is the one that is a swab in your nose or in your mouth, and it is looking for the actual RNA of the COVID virus. It is very good because you don't accidentally end up with COVID virus, right? Like unless it's there. It's a very sensitive and specific test, and it has improved, of course. You know, as we've continued to build technology, it's been very good. It's sort of the gold standard from the beginning. The second type of test broadly is the antibody test. That one has also been around for a long time. And as a reminder, the antibody test is not a test for active infection. It is a blood test that is looking to see whether you were exposed to COVID in the past, infected, and recovered, and have at least some amount of antibodies, which means some amount of immunity. Early on, a lot of the antibody tests were not very good. There were a lot of antibody tests out on the market that had not really had the appropriate FDA approval. We were really not promoting those as being particularly accurate in the early days. At this point, the antibody tests, that's all been cleaned up, are good. So if you get a positive antibody blood test, chances are very good that you had COVID and you've recovered. I want to be clear that that does not mean that you can say, I don't need to wear a mask, I don't need to worry about COVID, although it is highly unusual based on what we know. There have been reports of people who have gotten COVID again, a slightly different strain. We can talk more about that if people had questions. But also, we don't know how long some of this, immunity may last. We don't know how it works in different age groups. CDC is thinking, about 3 months. It looks like there is at least some protection. But bottom line is that antibody tests let you know you had COVID in the past, probably have some level of some protection. But it doesn't mean you can stop wearing a mask, doesn't mean you won't need a vaccine, none of that. So those are the two that we've been talking about for months. Just recently, a third type of test has really come more prominently onto the market, and that's called an antigen test. And the antigen test is still a nose test or a mouth test. I should note, by the way, there's been progress for both the PCR and the antigen tests that we're not always needing to do those very deep, nasopharyngeal, where you have to stick the swab very deep. There are many, you can now largely do a nose test with just a little bit of a swab into your nose. But the antigen tests are, instead of looking for the RNA of the virus itself, they're looking for a protein that is produced by the virus. And this is good because it is a faster and easier and cheaper kind of test. And importantly, it does not necessarily need to go to a laboratory. If you're looking for the RNA, you have to run through specialized machines. What got a lot of attention just in the last few weeks are these rapid antigen tests that are on a card, meaning that you can do a nose swab and it can go on the card, and the card can tell you a result without ever having to send it to a laboratory. It still has to be done by a health professional, and officially it is only FDA approved for people who are symptomatic, although the government is starting to send them for use in long-term care facilities and some other facilities for some more widespread testing. Antigen testing is still officially, if you have a positive antigen test, it's considered a probable test, a probable confirmation as opposed to a confirmed one. But in a setting like Chicago where there's a lot of COVID around, especially if somebody is symptomatic or has a known exposure, a positive antigen test is considered, a positive test in terms of public health action. It is not not quite as good as the PCR, but it is cheaper, more widely available, faster, etc. So there are rapid tests available now, both for the PCR and for the antigen. And I think when you go rapid, you lose just a little bit though. They're very good tests by and large. And what we do here is that in a setting where there's quite a lot of COVID around, a positive test is considered a positive test. If you want to learn more about the details of any given test, go to the FDA page, and there's all sorts of details on there. But I hope that helps clarify that question. Okay. Julian Beckwith from Twitter says, one stipulation to move to phase 5 in Illinois was to have an available vaccine and or treatment. Given the current outcomes, the current COVID outcomes, it seems like there are reliable treatments. Okay, how close is Illinois or Chicago to phase 5 or continued loosening of restrictions in phase 4? Okay, so there's a lot in that question. So first, in the middle of there, you note that it seems like there are reliable treatments. And I want to make sure I put a little bit of context around that. There has been some progress in terms of some treatments for COVID, but they are still fairly limited. And all they've really been shown to do at this point is, for example, when people are admitted to the hospital or to the intensive care unit or they're on a ventilator, when they get some of these medications, it decreases the amount of time that they might be in the ICU or on the ventilator. There's some evidence that you are less likely to sort of have a serious outcome or die. They are important, but we are a long way still, unfortunately, from a treatment that is available or has been shown to have promise, especially for people with more mild COVID, or that has been sort of a real kind of blockbuster in terms of treating COVID. Different than flu, for example, right? If you get influenza, there are medications available that you can take, especially right after you're diagnosed with flu, that significantly decrease your likelihood of getting seriously ill, hospitalized, et cetera, from influenza. We unfortunately don't have anything like that yet for COVID, and although there are many, many studies ongoing, none of them have really been proven to be very effective in a way that would be available to the population or would make us feel like, okay, somebody gets COVID, you treat them, you cure them with this, right? We could get past COVID in that way. So some of the reasons, we have gotten better at treating COVID, to be clear. A lot of that, I think, just has to do with a lot of the practice of our hospitals. So things like knowing better when people should go on ventilators. There's been practices that you use in the intensive care unit and how you position people. There's been a lot of work around just trying to improve on that supportive care, we call it, which is caring for people who have been really overwhelmed by COVID. We know now that COVID can lead to what's called a vasculitis, an inflammation in the blood vessels. So there's medications that we give to sort of decrease that risk. We've learned a lot about how it interacts with the immune system, and so there's medications you can give. One of the treatments that's been proven to have progress that's been proven to help is a very basic, steroid that's been around forever, very inexpensive, but it helps tamp down the sort of hyperimmune response that can flood the lungs and really cause people who are very seriously ill to become sick. So bottom line is I'm not feeling very optimistic for a major breakthrough in a treatment that would move us to phase 5. Vaccine, we're on track, I think. We've got to wait and see what these trials look like. We've talked about this a lot. We will absolutely wait until the appropriate amount of testing and follow-up has been done, just like we do for any other approved vaccine, before we will make a recommendation for a COVID vaccine. But the way things are going, I'm optimistic. Perhaps the very end of this year, early 2021, we may see our first approval of a vaccine. That doesn't mean it'll be available yet, though. And so it'll probably, I do think 2021 will be the year of getting vaccines in Chicago, but it's going to be a long process, sort of probably over the whole year of vaccinating. So The state did define that as the decision to move to phase 5. So really, my goal, first and foremost, is to keep us in phase 4, right? Like to not have to go big steps backwards. And we will be following the same things that we laid out at the beginning of phase 4 to make those decisions about whether we would be able to continue to loosen restrictions or need to tighten them again. So today is the day that loosening of restrictions went into place. If for the next 28 days, things continue to look just as good as they have for the last 28 days, if things stay stable or declining in terms of cases, corrected for testing as needed, if positivity stays good, if our hospitals, we're not seeing increases there, if everything continues to look good in the way that we've laid it out in a data-based way, that would be how we would move ahead. And you can go to, at the very top of the chicago.gov/coronavirus under data, if you go to reopening, you'll see all those metrics laid out. Sandy Rusinski Livingston on Facebook is asking, when is the best time to get the flu shot? Right now, please. So we would like everybody in Chicago, with very few exceptions, unless your doctor tells you otherwise, everybody over the age of 6 months should get a flu shot this year. It doesn't count if you got one last January or February. It needs to be sometime from when it was available this fall, so August on. And we would really like you to get a flu shot, ideally before we are in the throes of flu season. So October is the perfect month to get it. It's the first day of October. Make October your month about getting your flu shot if you haven't already done it. It takes 2 weeks for your body to build up the protection that's going to be built up against circulating flu viruses. So the sooner you get it, the sooner you will have some of that protection against flu. Angie Nancy Gamez on Facebook is asking, can you get the virus again after having it already? Okay, so this is slightly to what I was mentioning before. There have been documented cases of people getting COVID-19 a second time, but these seem to be very rare. Again, we continue to learn about this. But for example, there was a very good case report out of Hong Kong. There was another very good case report out of Nevada that documented people who had clearly been diagnosed with COVID-19, had recovered, had had negative testing, tested positive again, and they had the virus samples from both of these times available, and they were able to actually do the genetic fingerprinting on that and show that the virus itself had slight differences. That lets you know it was, that genetic fingerprint lets you know it was actually a second infection, as opposed to some other people who have had just long shedding of virus. Even though they're not spreading it, you can continue to detect it if you test it. So it is clear that it is possible that people can be infected a second time, but it does not seem to be likely. This is really one of the questions that I've been most interested in, and there are a lot of people looking at around the world. And in large settings where people are looking at full country databases or hundreds of thousands of tests, it's very, very unusual. Well, first, we don't often have the samples available. More is being stored now, but we don't always have the samples available to do that genetic comparison. But we even look to say, do you have people who were positive and tested negative and tested positive again? Even that is really very rare. So like I said before, we're still learning about COVID. If you've had COVID and you've recovered, great. Keep wearing your mask, keep social distancing, keep doing the things. The last thing I want somebody to do is think, oh, I had COVID, I can't get it again, I'd be fine. And as more of that data comes out, as COVID has been around longer in the world, we will continue to know more about it and have more updated information. So good question. All right. Number of things. All right, I think as the last question here, Jennifer Ross on Facebook is asking simply, where's Sybil? Question and a smiley face. So Sybil Madison, our deputy mayor for health, for human services and education, who has long been my co-host here, has mostly moved to doing a lot of the more, a lot of the organizing and the coordination in the space. There were a couple times she wasn't able to make it, but it was because she was having really important meetings about education and COVID, or about, coordinating on things. She is an even busier woman than I am in terms of the things on her plate, and so, I don't think she's gone for good, but we've decided, and we're going to keep doing the guests, on Tuesdays like we've had, and I promise she'll be back at some point, but we've moved her off of the regular rotation just because it takes a lot of time to do this, and I care a lot. We all care a lot about making sure that everybody's getting the information. But Sybil is doing just fine. She's at work, and thanks for asking after her. Remains a super important partner on all things COVID, as do so many people at the mayor's office. Okay, we are just about at time here. Thanks for all the good questions today. As a reminder, if we didn't get to your question today, you can continue to put it in the chat box or with the hashtag #AskDrArwady. On the days we don't do live Facebooks, we are posting sort of individual question answers, working to get those translated into Spanish, etc. Particularly where we see questions coming up repeatedly, we do try to prioritize those in the next live version as well. So if we didn't get to your question, don't worry. We'll try to get to it in the next time. Press conference today at 1:30 p.m. You might have noticed I didn't take any of those questions about Halloween, and that's partly because we'll be giving some updates about Halloween this afternoon. So join us for that, and just a general update on COVID this afternoon. As I mentioned, today is when the updated reopening guidelines go into effect. If you missed that and want more details, go to chi.gov/reopening. Also, today is Business Affairs and Consumer Protection that I mentioned that does a lot of the enforcement. Rosa Escareño, who's the commissioner there, has been on with me before as a guest. And today is their Small Business Expo. So there are free webinars going on online by banks and city officials and others who can help support small businesses in various ways. There's a panel discussion about business resources for resiliency. So you can go to Chi Small Biz Expo, that's CHI Small BIZ Expo.com. ChiSmallBizExpo.com, or if you just search for BACP, you'll find it. They're being recorded, so you can see them after the fact as well. And then finally, if folks missed it, tomorrow our updates to the emergency travel order included Kentucky, Nevada, Texas, and Wyoming. So you can go to the coronavirus webpage if you need more information about the travel order. Thank you very much for all the questions today, and be safe, Chicago.